Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
What if the seemingly innocent dental work you've received over the years is the root of disease throughout your body? Mission Evolution Radio TV show is coming to you around the world on the X-Zone Broadcast Network, xzbn.net. With us this hour to explore the hidden toxins behind all disease is Thomas E. Levy. Dr. Levy is a board-certified cardiologist and bar-certified attorney. After practicing adult cardiology for 15 years, he began to research the enormous toxicity associated with much dental work, as well as the pronounced ability of properly administered vitamin C to neutralize its toxicity. He's now written 13 books, with several addressing the wide-range properties of vitamin C. His website, tomlevymd.com. Dr. Levy, thanks for joining us on Mission Evolution.
Hello, Gwilda. How's everything?
It's going well. It's going well. So are you in Florida?
No, I'm in Puerto Rico.
Oh, okay. So you haven't been getting those storms, thank goodness.
So we've been dodging it so far, yes.
That's a good thing. So as a cardiologist, what drew you to research toxicity and its association with disease?
Well, I didn't even know where everything was going until I met Dr. Hal Huggins some 30 years ago in Colorado Springs. In my opinion, the first true, what we call biological dentist in the world. And I was having, shall we say, wasn't particularly pleased with doing my cardiology. It was, and when I met Dr. Huggins, he introduced me to some concepts that I'd never seen before. He invited me to his clinic, and I saw diseases that weren't supposed to respond when they got root canals taken out, amalgams taken out, mercury amalgams, and when they got intravenous vitamin C given intravenously before, during, and after the dental work. And it was just completely new experience for me, and I like to give Dr. Huggins complete credit for really giving me my first true medical education.
So what were you observing when people were getting vitamin C IV at the time?
Well, in this particular setting, it was the first time I saw it, it was dramatic. A little old lady in a wheelchair, not too strong, obviously, gets in the dental chair, gets extensive dental work for 2 or 3 hours, and becomes decidedly more and more animated and more energized as the dental work goes on, until she finally talks to her caregiver and say, let's go out to some place in Colorado Springs and have a good meal tonight. I can chew on the other side. And I said, this just doesn't work. And Dr. Huggins walked in at that time, pointed at the IV bag and said, that's what's doing that. And I said, okay, I bite. What is it? And he said 50 grams of vitamin C. Well, I was like every other mainstream doctor at that time. Vitamin C was something you got from an orange, and it was good for you, and it prevented scurvy, and that was about it. But when I saw, in fact, what dosing vitamin C does by vein in such patients as I was witnessing there, I literally changed my life in the blink of an eye. I never turned back from that point in time. And that particular incident began my 4 years of research study before I wrote my book, extensive book, Curing the Incurable Vitamin C Infectious Diseases and Toxins, back around the year 2000.
So let's change gears a little bit so we get people set up here. What is oxidative stress?
Oxidative stress in a nutshell, and it's a very important concept. Oxidative stress means the point in time you have a excess number of oxidized biomolecules relative to reduced. And what does oxidized mean? Oxidized means electron depleted. So when you have biomolecules, RNA, DNA, proteins, sugars, etc., enzymes lose electrons and become oxidized, they also lose their normal biological function. So they become non-players. And that, in fact, is what all disease is. All disease is the biomolecules you have oxidized, where they're located, where they're concentrated. There is no other disease process that oxidation causes. The oxidation itself is the disease. And that's an important concept because in the literature, they'll frequently say oxidative stress causes disease. Well, that's not too far off the mark, except, like I said, it is the disease. It's not causing some other further pathological process inside the cell. It's just the fact that you have a unique array of biomolecules in the oxidized, non-functioning state. And when you maintain it that way, the cell stays sick. When you get enough antioxidants in to go back and give electrons back to those biomolecules, reduce them, and bring them back to normal function, you can regain, you can resolve whatever the disease process is. But that doesn't usually occur because, for a number of reasons, we're usually taking in far more new toxins on a daily basis than any amount of good antioxidants we can take in. So the balance continually goes to some degree in the favor of gradually increased oxidation, which is why chronic diseases are chronic and gradually get worse.
So, what causes oxidative stress?
Well, in a word, toxins. The thing that causes oxidative stress are molecules that the only thing they want to do is take electrons away from biomolecules. And a toxin, when a toxin comes into your body, any toxin, it's electron depleted. And in order to become chemically stable, the toxin needs to find biomolecules, take their electrons away, and in so doing, as I said, render those biomolecules dysfunctional or non-functional. And this truly is the reason why I think my next book, not really close to being ready, will be entitled Toxins Cause All Disease. That's because a toxin is something also called an oxidant. It's a radical oxygen species. It's a free radical, or it's just a poison. Those are all synonyms for toxins. And if you don't have biomolecules getting oxidized, you'll never have a disease, any type of disease. But when you have toxins present that cannot be quenched or cannot be taken out of the body before they do their damage, then you get oxidation. So it's toxins that cause oxidation, and we see a lot of other different synonyms for them in the literature, but bottom line is a toxin only can damage you, only can poison you to the degree that it will oxidize or take electrons away from otherwise viable biomolecules.
So, you say that all disease is oxidative stress, and yet we see disease has all sorts of different faces, and thus we have all sorts of different diagnoses. What dictates how it expresses?
What dictates how it expresses is the characteristics of the toxin determining what biomolecule gets oxidized. In other words, for example, if you inhale cyanide, okay, you'll be dead in a minute or two. Why? Because the cyanide goes into the lungs, you inhaled it, it goes into the respiratory cells, and because of its chemical configuration, it selectively oxidizes the enzymes that those cells need to incorporate oxygen and metabolize oxygen. So within a minute or two of inhaling cyanide of an adequate amount, you shut down your ability to bring in new oxygen, and you basically smother to death because of that. Now, another example then is something that lasts a long time. You might have mercury amalgams in your mouth, outgassing mercury into your body for years, decades even. And you don't notice any problems because the mercury is in other places that don't manifest themselves as readily clinically. But after 10, 15, 20, 30 years, then you might start developing symptoms of a neurologic disease because the mercury has finally accumulated in the different sites that it needs to accumulate to cause, say, multiple sclerosis. So it's all got to do with the toxin's biochemical characteristics determine where does it go? So what biomolecule is it compatible with? Uh, is it, let's say, water soluble or fat soluble? Is it ionic or electrically neutral? Is it a very large molecule or a small molecule? Is it easily mobilized and excreted, or does it tend to accumulate? And it's all those characteristics that determine what biomolecules and what concentrations stays in the oxidized afunctional state. And this can be outside the cell, but most commonly, all your disease, all your significant disease is inside the cells. So you're talking about increased oxidative stress in the cytoplasm or the endoplasmic reticulum or the mitochondria or the nucleus. This and all the combinations thereof is what determines what your unique clinical expression is of that particular disease.
So the in a nutshell, whatever the toxin is will kind of dictate the expression of the disease.
Right, by virtue of the
Okay.
fact that its unique chemical characteristics will also determine that it goes to and oxidizes a unique array of biomolecules.
Gotcha. So where does most of the toxicity in the human body come from?
Infections, infections. We also have a lot of toxins from areas we don't suspect, and these are in the form of heavy metals. We have a lot of heavy metal exposures, and we're now getting evidence that is accumulating to massive degrees inside our organs and inside our heart in particular. But the real thing that is going to make the most difference the quickest for most people is identifying sites of infection, occult infection. This most commonly occurs in the mouth in the form of chronically infected root canal treated teeth, which are all infected. None of them are sterile. Abscessed and infected, but have never been instrumented or had a procedure on them. Chronically infected gums, which is usually the reason that you end up having an infected tooth, and then chronically infected tonsils that have been draining these chronically infected teeth for weeks, months, or years. And we have plenty of evidence to show how the pathogens unique to the mouth selectively go into the breast and cause breast cancer, and they selectively go into the lining of the coronary artery to deplete the vitamin C there and evolve atherosclerosis and eventually cause a heart attack. They go elsewhere as well, but those are the two biggies, breast cancer and heart disease. Well, that pretty much takes care of well over 50% of the developed world's population as far as cause of death.
Well, it's time. Dr. Levy and I are going to have to take another commercial break. Dr.
All right.
Levy and I will return shortly, so don't go away. This is Mission Evolution, www.missionevolution.org.
One people, one nation, searching through the night.
Is our world becoming more toxic? With us this hour discussing toxicity and human health is the author of 13 books addressing the topic, Dr. Thomas E. Levy. Dr. Levy, is our environment becoming more toxic?
Enormously. Uh, Unfortunately, very little attention is paid to not only the toxins that we've chronically been exposed to and we know about, but new chemical processes, new production, new plants, new forms of pollution, new ways of preserving or poisoning, if you will, our food supply. I All we can say is there's a massively much greater level of toxins in the human body now than in 100 years ago. Not the amount of difference is enormous. And as we mentioned in the previous segment, toxins are what cause oxidation, and oxidation is disease. So when you have a mountain of toxins and you can't possibly take in enough quality antioxidants to neutralize them, once you start to get sick, the only question is really how quickly do you go downhill? Because if you can't stop the new toxin onslaught, you're just going to progressively get to fatal levels of increased oxidative stress inside your cells. Now, as we mentioned also, there are clear toxin sources that appear to be more significant than others, but that doesn't mean we should ignore any way to clean up our environment and the air, food, and water that continually brings new toxins into our body outside of the infections that are present in our bodies.
So, what's the greatest source of new toxins, would you say?
Uh, Again, infections coming from the mouth. Okay, those are the amount of data, and it's been unfortunately denied by dentistry for years. And this is what Dr. Huggins spent a lot of time demonstrating. This is what Dr. Weston Price in the 20s, 30s, and 40s, a dentist, showed to a great degree was that the wide range of diseases and conditions that root canal teeth to teeth, for example, would do to the body. Uh, they would, for Weston Price, for example, would take sometimes a root canal treated tooth out of a patient who either had heart disease or had a heart attack or was dying of a heart attack, and then take that tooth and just tuck it underneath, surgically underneath the skin of a rabbit, and the rabbit would die of a heart attack in a few days. And he was able then to take that same tooth and put it in up to 30 to 40 consecutive rabbits, and poor rabbits, they all died. He was able to show a similar thing by taking root canals out of patients with neurological syndromes, and the poor rabbits would get the neurological syndromes just like the human beings. So not only did the pathogens produce toxins, they produced toxins with a specific biochemical identity that allowed them to go to specific tissues to cause their oxidation and their disease.
If this would become more mainstream, it would totally change our diagnosis process, wouldn't it?
No question, no question. There's a test out there now called the 3D X-ray, which is more technically called cone beam computed tomography, CBCT. And it's basically a CT scan of your mouth, but it's done with a rotation so that when you have the test and you're able to read it, you can literally look at all the teeth from any angle that you want. Regular x-rays suffer from just being straight on, and you often have a lot of overlapping of tissues and bone, and many of even the largest defects and abscesses and infected teeth can be missed. But with this teeth, we now see that, and this is covered in my book, Hidden Epidemic, we now see that an incredible number of teeth are abscessed. Yes, that's the word, abscessed, but they don't hurt. And so, unless you go to the trouble of looking for them, you're not going to find them. Most people think an abscessed tooth hurts. Well, an acutely abscessed tooth does. And you go straight to the dentist and get it out because you're going crazy with pain. But well over 95% of abscessed teeth are completely asymptomatic. This is still little appreciated, even among many dentists. But it's absolutely critical that a practicing medical doctor realize this, because when a patient gets high blood pressure or gets diabetes or it contracts a cancer or develops any sort of new medical syndrome, you need to go straight to this test to make sure, especially if a previous test showed it did not exist, you need to go straight to this 3D x-ray and see if you've come up or developed a new abscess tooth that's now feeding so much toxins into your system that you develop this new medical problem.
So, how long have we been using these dental practices that are creating toxicity? When did that start to happen to us?
I don't know when the first root canal was done. I would suppose Dr. Price was looking in the 20s. Certainly, probably in the late 1800s, but definitely by the 1900s, they were a regular part of dental procedures. And since then, they've just skyrocketed in incidence because they make a lot of money for the dentist. They're easy to do, although they're not easy to do correctly. And when somebody does decide to have a root canal, they really need to go to a dentist that does the highest volume. Not that I would ever recommend a root canal, but it's the patient's decision to do that. And also, the really big thing is nearly all the time somebody goes to the dentist because the tooth hurts. Well, it hurts because it's painful or abscessed. And what the root canal does is temporarily drain the abscess, taking the pressure off the tooth, and then it evacuates the pulp of the tooth, which takes away all the nervous innervation of the tooth so that you don't eliminate the infection, you just eliminate your ability to feel the infection. So if a patient goes in with a hurting tooth and comes out with a tooth that doesn't hurt anymore, then they consider that, not surprisingly, to be a successful procedure, even though you've left the site of infection in the mouth.
So, well, we're covering that the infection itself is creating a lot of toxicity and ill health, but you also mentioned amalgam. What's it doing? It's in our fillings, right?
Right. Well, what they call silver fillings have been conveniently mislabeled because they're 50% mercury. And they also try to tell you early on, well, but don't worry about that. It's uh, completely chemically interacting with the other metals so that there's nothing being released. And that's absolutely not true. We have clear video evidence of 10, 15, 20, 30-year-old amalgams just putting little plumes of mercury vapor uh, into the uh, into the mouth above where they come. And when obviously you chew on them or have acidic foods, this gets even higher. Well, mercury is considered to be the most toxic non-radioactive heavy metal on the planet.
Oh my
And,
goodness, I had no
and,
idea.
and anytime you have mercury or you're talking about mercury, they talk about a no-touch technique. They talk about special OSHA ways to dispose of mercury. But apparently, and this is not said completely in joking or in jest, OSHA apparently considers, even though there's no place on your kitchen table you'd want mercury, but it's okay to put it in your mouth for the rest of your life.
Yeah, that doesn't make much sense. Are dental practices changing to address the toxicity from infection and mercury?
Very slowly, but they are progressing. We have a number of different biological dentist type of organizations, and even some that have both dentists and doctors, which are the best, interacting with each other so that especially the docs can be aware of dentists that they can send patients to be properly evaluated or treated when they're having any sort of difficulty with a particular medical disease. Now, it's nowhere close. I couldn't give you a percentage. The percentage would still be quite tiny, but certainly relative to when I started all this out with Dr. Huggins 30 years ago, the number of dentists and physicians who are aware of the enormous contribution of dental toxicity and dental infections to chronic degenerative disease has substantially increased. We got to go a long, long, long way to go, but at least we have our foot in the door.
So, as our listeners are hearing this, and they've got maybe somebody has a mouthful of mercury, they're wanting to have it removed. What do you have to watch out for once you're going in to have it removed?
I'm glad you asked that, Gwilda, because it's very, very, very important. Don't go running off to your family dentist or the dentist that you like or the dentist your husband plays golf with or you play golf with or this, that, or the other because they don't know what the hell they're doing. And they will give you a massive mercury exposure in the reduction process that can cause a great deal of harm. One of my best friend's wives did exactly what I just said. She knew about the toxicity of mercury, but she didn't realize a special procedure was involved, went off to her family dentist, got the mercury taken out, and went deaf in her right ear permanently. So you get an enormous toxin exposure when these come out, and there are specific protocols in a number of the biological dentist organizations, IAOMT, and IABDM. These are two of the most prominent ones. And you don't have to go, if you want to protect yourself, to a biological dentist that follows those removal protocols to the T.
So what's involved in that that the normal dentist wouldn't know to use?
Well, you use a rubber dam, which
And
prevents
what is that exactly?
that just is something that allows nothing to go down the throat. It just isolates the tooth in front. You have special vacuum type situations to pull the mercury out around the area. You also have dentists who are aware of how to use appropriate toxin neutralizers, including vitamin C, either in the oral liposome form or intravenously, as Dr. Huggins did, and a number of other issues. Okay, I mean, I don't want to pretend to you that I can tell you the whole protocol in 30 seconds, but it's an involved protocol, but it stood the test of time, and people get better after their mercury removal, not worse.
That would be an improvement to get better instead of worse. It is time for yet another station break. Dr. Levy and I will be right back to continue our discussion, so stay right there. This is Mission Evolution, missionevolution.org.
What's real is not, reason fails me. I've gone beyond all known pathways. This is the end of reason. This is the end of time. I am alone, alone and broken. I am apart from what was mine. Pila Maya yellow, Pila Maya yellow, Pila Maya yellow.
Why won't an infection just stay put? This is Mission Evolution, missionevolution.org, with us discussing effective treatments for eliminating toxicity and the resulting disease is Dr. Thomas E. Levy. His website, tomlevymd.com. Dr. Levy, I think we'd like to back up just a little bit and ask, why don't infections stay put? You mentioned that an infected tooth can then end up in the breast or in the heart. What's the mechanism behind that?
Well, first of all, although infections can occur in any teeth, the teeth that get most commonly involved with either root canals or chronic abscesses are the larger molar teeth that you grind on and grind between. And when two opposing molars meet each other in the course of chewing, I don't think there's any other circumstance in biology or nature where you generate higher pressures than when you grind between two teeth. Now, what does this mean? Well, the tooth has a venous blood drainage and it has a lymphatic drainage, both of them. And when you chew on this, and especially on a heavily abscessed tooth, what are you doing? Each time you chew, you express and push toxins and pathogens directly into the bloodstream and directly into the lymphatic drainage. Now, the lymphatic drainage in the mouth is all gravity dependent and goes straight down through the neck and the thyroid gland, many thyroid problems, and down into the breast. And then it needs to go back up after it goes down into the breast, back to the upper part of the breast before it goes into the armpits, and then eventually the lymph gets filtered out and the lymph goes back into the blood. So you have a direct pathway of these highly potent pathogens and toxins in these teeth going directly into the breast. And in fact, in breast cancer, there is on both biopsies, both the cancer itself has a lot of pathogens in it from the mouth, and both the extracellular space around the cancer cell has that as well. Because generally, you always need massively increased oxidative stress at a site, in this case, an area in the breast where the lymph is not moving briskly enough, but instead it's accumulating and collecting. Then the oxidative stress skyrockets, and then you eventually get a malignant degeneration and you get breast cancer. On the other hand, when the toxins and pathogens are being expressed into the venous blood drainage of the infected tooth, we have a different sequence of events, but just as significant, which is these toxins then go into the venous blood. Now, the venous blood, of course, most people know is low pressure. It's the arterial system that has high pressure. So as long as these pathogens or toxins are in the low pressure venous system, they circulate, they go back to the pulmonary system, go into the pulmonary system, come around, and then everything's still low pressure. And then finally you have it emptying into the left ventricle, the left atrium, which is still low pressure. And then finally into the left ventricle, where with one contraction of the left ventricle, you go from venous low pressure to arterial high pressure, and it's the coronary artery that gets 20 to 25% of that cardiac output, and the highest concentration of pathogens and toxins get now physically impacted on the arteries. And then once that happens and the pathogens are able to colonize, not grow like a gross infection, but just colonize, then they rapidly use up the vitamin C inside the arterial wall, which issues in an immune response that becomes chronic because the pathogens are never eliminated. And it's the chronic immune inflammatory response that eventually results in the development of atherosclerosis, which is actually designed to protect the vessel, because when you lose the vitamin C, you lose wall strength, and you have the risk of the artery eventually ballooning and rupturing with an aneurysm. Well, if you no longer have the vitamin C to make strong cell wall, to make strong arterial wall, the second best thing is to make the wall thicker. So really, the atherosclerosis is an attempt to make the wall thicker and have the blood vessel less likely to rupture.
So let me see if I get this straight. The lymphatic system is very slow moving. Okay. The venous system is where the blood is returned to the heart versus going out to the body. And isn't it
Right.
returned by muscle contraction? That
Well, that's
being,
part of it. But I mean, we're talking about it eventually drains into the heart, and before it even gets to the muscle, you have the left ventricle that contracts, and as I said, get 20% of the coronary output before it even goes anywhere else in the body. But yes, your muscles do play a role in not only lymphatic flow, but in promoting good blood flow as well inside your blood vessels. Sure.
and the reason I was asking is that why exercise can make such a difference in our health.
That's certainly one excellent reason, Wilda. One excellent reason. Uh, I think a lot of situations, especially because of what I just said, where your lymph system is dealing with a large amount of chronic drainage of infected sites. The lymph system is designed actually to purify the lymph before it gets returned to the body. So it's actually an infection remediating system if the infection or pathogen load doesn't get too high. So yes, exercise definitely helps, probably much more so than the blood circulation. It helps get a good, healthy lymphatic flow so that you don't have any areas of pooling. I also said in my article that I wrote on this for the ladies that are concerned about what to do, in addition, of course, to the obvious things about infection and supplementation, is to, once they're laying flat on their back in bed at night, to do not a prolonged, but a good breast massage, so that the areas that were normally gravity dependent are now at the top, and you can, with slight massage, promote any accumulated or slow flowing lymph that you've had during the day on out of your breast and on into the armpits where it gets processed.
So this kind of makes sense why a lot of the inverted positions in yoga and other practices can be helpful as well.
That's absolutely correct. Yes,
If not addressed, do both toxins and heavy metals continue to build up in the system?
absolutely, 100%. Heavy metals in particular just love to accumulate. They don't get readily excreted, and unless you give them either chelation, special agents that are designed to bind them, or you just use good toxin eliminators. In other words, you just ramp up the detox mechanisms inside your cells, the enzymes. Yes, these things can be eliminated, and everybody should be on a good protocol of heavy metal excretion. I mentioned that in 1999 they had an article that looked at people with advanced congestive cardiomyopathy, really big hearts, candidates for heart transplant, and on biopsy they found 22,000 fold. That's 2,200,000% more mercury inside those cells than in normal heart cells.
Oh
This
my.
is just enormous. Many of the other heavy metals, not to the degree of mercury, and one other heavy metal, also astronomical, was antimony. It was 12,000 fold more concentrated. Antimony is like as toxic as arsenic. Where does the antimony come from? Plastic.
Oh,
Okay, we got to stop drinking out of plastic containers, the plastic water bottles. I don't know why Coca-Cola and everybody else went to plastic, maybe for economy, but we need to go back to glass containers.
is stainless equally good? Like if you're using a stainless water bottle, is that fairly safe?
Certainly, there'd be no problem with antimony. Stainless steel does give a nickel contamination. I don't know how severe that would be off the top of my head, but glass would be best.
Otherwise, there's no escaping it. Changing gears just a little bit, is toxicity existing in the mother passed to the fetus?
Lots of different toxins get passed from mother to fetus, sure. I don't know if any particular ones would be at the top of the list, but yes, this is one of the important reasons that mama eats extremely healthy during pregnancy as well. I mean, the the little fetus is just a absorption machine, if you will, for processing all the good stuff that the mother gives it and all the bad stuff as well.
Would you suggest that any dental work or whatever that you're going to do to remove the amalgam fillings is done before pregnancy so that you have time to clear out?
That would probably be best. I mean, I don't know if they've ever done a study on this, but yes, that would probably be best. You certainly wouldn't, I don't think, want to stir things up in the middle of a pregnancy. So yes, that would probably be the best approach.
What is chelation?
Chelation comes from I think, a Greek word for meaning claw, which actually means you have a molecule that actually, like a grabo machine, if you will, clamps on to a toxic molecule, and then the entire complex is excreted. There aren't that many true chelators, but there's a lot of what I call toxin mobilizers. Now, probably the classical true chelator is something like we know as EDTA. Uh, and a lot of the treatments involve EDTA, either orally or intravenously. But there's a host of other toxin mobilizers, including vitamin C, including sodium citrate, including alpha lipoic acid, and other things like this that strongly promote toxin excretion. The two things that should always be remembered, especially if they can be afforded for toxin elimination, especially heavy metals, is sauna, okay? And this brings out the whole variety of toxins. You get them all. And proper supplementation. I put together a 8 list, what I call the Super 8 supplements. Uh, Quickly, they're vitamin C,
We're
magnesium,
we're
vitamin D.
we're going to have to
Oh,
pick up on that on the
all right,
other
sure.
side of a station break.
Very good.
Please stay with us as Dr. Levy and I continue to explore the hidden causes of disease. This is Mission Evolution, www.missionevolution.org.
Pila Maya yellow, Pila Maya yellow. lie by on the edge of his dream. A whisper of touch, an unheard song. Those bird takes flight, prompted by his broken heart. Fly high, sweet Venus.
Are you toxic? Are you sure? This is Mission Evolution, missionevolution.org. We're continuing our discussion with Dr. Thomas E. Levy. His website, tomlevymd.com. Dr. Levy, how can a person tell if they're suffering from toxicity?
Well, there's different tests you can do where you take certain chelators and they do a challenge test and you see how many different heavy metals are spilled in your urine. And that's fine if you're feeling sick and you want to get a quicker idea as to whether or not something specific might be causing how you're feeling. The point I was making earlier is everybody is toxic. Even if you feel well and you think you're well, you are toxic. And if you want to practice optimal measures for preserving your long-term health and minimizing the likelihood of a new disease just quote unquote appearing one day, only because it's just the one extra toxin that pushed things over the edge, you need to make the valid assumption that you have a ton of heavy metals in your body and you need to start doing everything you can to safely excrete them and eliminate them from your body. And that was what we had talked about toward the end of the last piece. What I want to also add and offer to people, I mean, this is nothing I sell or anything like this. And if you're not getting the details from this program, sending me an email, I can give you the protocol. Is I put together what I call the Super 8 supplements. And these are designed to minimize, if you will, oxidative stress inside the cells, optimize the production of ATP, the energy producing molecule inside the mitochondria. And these two things together just make everything in the body healthier. And when you make it healthier, you also kick out toxins. And in a nutshell, there's the first four are those that favorably reduce calcium inside your cells, which is always the cause of increased oxidative stress. And that's vitamin C in multigram doses, magnesium in multigram doses, vitamin D to get to a blood level of 50 to 100 nanogram per cc, and vitamin K2, about half a milligram a day. The other four, and this is where I've just seen people just take off. I mean, I've been using this protocol for about a year now, and I haven't seen any condition not improve, sometimes dramatically when everything else was not working. The second four work on the production of ATP and stimulating inside the mitochondria what's called the electron transport chain, which has 4 steps, all designed to shuttle the electrons that you get from glucose in the Krebs cycle through this pathway to generate optimal levels of ATP. The first one is NAD, nicotinamide adenine dinucleotide, and this is facilitated by taking vitamin B3, niacin or niacinamide, and you massively increase the amounts of NAD inside your body, and especially in your brain. The second one is FAD, flavonoadenine dinucleotide, and taking large amounts of vitamin B2, riboflavin, on the order of 400 milligrams. Generally, multivitamins have 2 or 3 milligrams of this in them. And then the third stage is coenzyme Q10 all by itself, taking 600 milligram to a gram per day of that. And the fourth one is fed, cytochrome C oxidase is fed very effectively by a product known as methylene blue, and taking on the order of 20 to 30 milligrams of methylene blue a day, even without the other 3, strongly increases ATP production. But when all 8 are put together, I got to say, for lack of a better word, magic starts happening for a lot of people.
And it's so wonderful that you just recommend it. It's not like you've put together something, named it after yourself, and sell it at an exorbitant price. So we really appreciate you doing this for us and giving us the list. And people can get a hold of you to get this list from your website. Is that correct?
No, they can send an email at the televymd@yahoo.com. But
Thing.
I don't understand. I'm not doing consults, so don't tell me everything you've got going on and say, what do I do? I mean, I can answer general questions, but generally I give out a large body of information, and I don't like to answer questions until I know people have taken their own precious time to read the stuff that I've sent them.
Absolutely, absolutely. So, what are the best ways to identify and eliminate toxins? So, we have this vitamin protocol, which looks very powerful, and you were mentioning a way to identify them, and that's if you would go over that again. I didn't quite catch that all.
Well, they have what they call challenge tests. They have different chelators that you take in a prescribed dose, and it strongly pulls out non-specifically a number of different toxins in your body. Usually we're looking at the heavy metals, and they have different laboratories that when you do a 24-hour urine, you can see very well relative amounts of the heavy metals, and different people will have different profiles.
So,
And even
do
though
you have to? I'm sorry. Do you have to go through a doctor to do this? It sounds like if you're going to get labs, you would have to.
for this particular one, you need to go through a doc because uh, you need the prescription dose of the chelator to stimulate to acutely stimulate the excretion of the heavy metals that would be measured in the urine. Yes.
And are there, it sounds like it's not something all doctors would necessarily know or work with. How do you find somebody that's going to do this for you?
Well, just like the biological dentist, you have the uh, alternative or orthomolecular or integrated medicine doctor, and those are growing in number as well too. And we have the internet. Ask your question online. Where do I go for this? Where do I go for this? The number of quick and available answers are increasing every day there, and most of the time, somebody can find someone that way. In the event that they don't have a friend who's already gone through an experience that can give a direct recommendation of a particular doctor for that type of thing.
So we've been talking about vitamin C. It sounds like the miracle drug, right? Um, why, if it's so impactful and so effective, why has it not been recognized by this day and age?
Gosh, Gwilda, you're assuming, and I say this with a straight face, you're assuming that the purpose and role of healthcare is to make people better. I'm sorry, it's not.
Yeah, follow the
Uh,
money, right?
Follow the money, okay? And so you get just the opposite. The proper use of vitamin C, in my opinion, would easily eliminate at least 50% of all prescription drugs. So,
So for those of us that are just sitting around our home here and deciding, well, we'd like to try the vitamin C, will just taking more vitamin C orally result in neutralizing the toxins and resolving infections? And if so, how much do we have to take?
well, that's different for everybody. I mean, some people have massive toxin exposure, massive toxin accumulations, and others less. And the piper must be paid. If you have, let's say, 100 pounds of toxins in your body and you take 50 pounds of antioxidants, you're falling short. So uh, basically, it's only done these days clinically. You start working with doses and you see how you feel. Most people who have never taken vitamin C supplemental before, almost regardless of the form of vitamin C, uh, feel significantly better once they start taking a few grams a day. And they develop what I call a new health quotient, a new health intuition, where they reach a better level of health. And then down the road, when they continue that dosing of vitamin C, they find that new toxic or infective challenges bring them down a little bit, and they know to increase the dose. But it's different forms of vitamin C. Liposome encapsulated vitamin C from the Live On Labs company is extraordinarily effective. And it's what I just about use exclusively for myself. I have an affiliation with the company, but because it's such a phenomenal product.
So all vitamin C is not created equal.
No, not at all. All vitamin C is good for you, but a lot of what the vitamin C is determined on how well is it absorbed. Does it go into the blood? Does it go into the cells? Some of those characteristics we were talking about, only in this case in the type of supplement. One form of vitamin C can be much better absorbed than another. That doesn't make one bad. It just means you got to take more of another to get the same effect.
Well, it's that time I get to ask you, Dr. Levy, what's your mission?
Well, That's a good question. My mission, I don't mean to sound corny, is to help people find the ways for better health and optimal health. And more specifically, I suppose, is to guide as many physicians and docs and healthcare providers as I can, regardless of their training, to appreciate a lot of the principles that I talk about so that they can deliver this healthcare to these patients. So it's really nothing more complicated than that. And to fight as best I can toward getting these concepts realized and not suppressed.
That would be huge, wouldn't it? Because they seem so simple, and I'm a layperson, but you've made it very understandable for me, and yet the doctors don't know about it. I mean, that just is
And
mind-boggling
many
to me.
doctors don't want to know about it. Okay, they will actively oppose families who want to have vitamin C given to their loved ones in the intensive care unit, and that, Gwilda, is criminal.
Mhm.
And
Absolutely.
it should be prosecuted criminally in the form of involuntary or negligent manslaughter when the patient dies.
Boy, I certainly hear you there. And it can. Do you think it can really turn a disease around if it's given even in cases that are really, really bad?
Oh, absolutely, all the time, no question about it.
Amazing. Amazing. Well, this has been such an enlightening conversation, and I thank you so much for coming on the show.
My pleasure, my dear. Glad for having me on.
You take care now. Unfortunately, we are out of time. Dr. Levy is wonderful to have on the show. He's Thomas E. Levy is the author of 13 books covering toxicity, nutrition, disease, and health. To find out more about Dr. Levy, where you can find his books and all he has to offer, visit his website, tomlevymd.com. And he also mentioned that you can drop him an email for quick information, and that I believe would be info@tomlevymd.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy past archived episodes, visit www.missionevolution.org. But please be sure to join us right here next time. This mission will continue, bringing information, resources, and support to our evolving world.
Phoenix, even though you are free, so above my broken life, bring your healing tears to me. Fly high, sweet Phoenix, let your flame burn ever bright.